Communication strategies in dementia care. Imagine this: an older adult asks the same question for the fifth time in 10 minutes. You already answered. You already explained. But they ask again. Many caregivers become frustrated. Many family members become exhausted. Many people think, why don't they remember? But dementia changes the way the brain processes information. The person is not trying to be difficult. The person is not trying to annoy you. The person is living with changes in memory, understanding, and communication. That is why communication is one of the most important skills in dementia care. Today, let's talk about practical communication strategies that actually work. The first strategy: do not argue with memory. This is one of the biggest mistakes caregivers make. Imagine an older adult says, I haven't eaten lunch today, but you know they ate lunch 30 minutes ago. Many people respond, you already ate. I told you already. The problem is this: the older adult may not remember. Trying to force them to remember often creates confusion and stress. Instead, try saying, you had lunch earlier. Are you feeling hungry now? Notice the difference. You are not agreeing, you are redirecting. The goal is not to win an agreement. The goal is to create comfort and security. The second strategy: use short and simple sentences. Many people speak too fast. Too much information at once can overwhelm a person with dementia. For example, instead of saying, we need to get dressed, take your medication, eat breakfast, and then we have a doctor's appointment. Break it into small steps. Let's get dressed first. Pause. Then now let's have breakfast. Small steps are easier to understand. Small steps reduce confusion. The third strategy: speak slowly. Many caregivers rush conversations. The person with dementia may need extra time to process information. Ask questions, then wait. Give them time to think. Give them time to answer. Silence is not always a problem. Sometimes silence is process time. The fourth strategy: pay attention to your tone of voice. This is extremely important. People with dementia may forget words, but they often recognize emotions. If your voice sounds angry, they may feel afraid. If your voice sounds frustrated, they may become anxious. A calm voice creates safety. A gentle voice creates trust. Sometimes your tone matters more than your words. The fifth strategy: use eye contact and body language. Communication is not only verbal. Sit at eye level, face the person, smile when appropriate. Use gentle gestures. Make sure they can see your face. Many older adults understood body language better than long explanations. A practical example: imagine an older woman asks, "Where is my husband?" But her husband passed away years ago. Many caregivers make the mistake of saying, "He's dead. I told you already." The problem is this: for the older adult, the gift may feel new every time. Instead, try responding to the emotion. You miss him very much. You loved him a lot. Then gently redirect the conversation. The goal is emotional comfort, not factual correction. The sixth strategy: avoid asking complicated questions. Instead of saying, "What would you like to wear today?" Try, "Would you like the blue shirt or the green shirt?" Fewer choices reduce confusion. Too many options can create anxiety. Simple choices create success. The seventh strategy: validate feelings. This is one of the most powerful techniques. Imagine an older adult says, "I'm scared." Do not immediately say, "Don't be scared." Instead say, "I understand that sounds difficult. I'm here with you." Validation reduces emotional distress. People want to feel understood. My method: when I work with older adults experiencing dementia, I remember one important principle. I am communicating with a person, not with a diagnosis. The disease affects memory. The disease affects communication, but the person still has feelings. The person still deserves dignity. The person still deserves respect. I focus on the emotional experience, not just the factual information. This approach reduces conflict dramatically. What viewers can apply today: use the 4S rule: slow, simple, short, supportive. Before speaking, ask yourself, am I speaking slowly? Am I using simple words? Am I keeping my message short? Am I being supportive? These four questions can improve communication immediately. Benefits: viewers can receive less stress for the older adult, less stress for the caregiver, fewer arguments, better cooperation, more trust, better quality of life, and stronger relationships between caregivers and those receiving care. My opponent, I believe dementia care is not primarily about memory, it is about relationships. Many people focus only on what the person can no longer do, but we should also focus on what remains. Their emotions remain, their need for love remains, their need for respect remains, their need for human connection remains. My advice: do not try to be a perfect caregiver. Try to be a patient caregiver. You will make mistakes. Everyone does. What matters is continuing to learn and improve. My suggestions: take care of yourself too. Many caregivers become exhausted, rest when possible, ask for help when needed, take breaks because a healthy caregiver provides better care. My final thought, a person with dementia may forget your words. They may forget your name. They may forget what happened today, but they often remember how you made them feel. If you make them feel safe, respected, valued, and loved, you have already accomplished something very important. Sometimes the matters more than perfect memory. Thank you very much.